Hi, welcome to the YouTube channel TA Therapy. Bob Cooke here, talking about working with self-harm. Been a psychotherapist for 27 years now. Many people self-harm in many different ways. I thought I'd do a quick presentation on this. So if you look at this screen here, I've started off with the question, why do people self-harm? Then I'm going to look at the presenting issues, then go on to underlying causes, and finally in treatment. So why do people self-harm? Well, mainly for two or three different reasons. Firstly, often because it's a cry for help. Secondly, they will often self-harm. So they don't actually have to feel the real emotional feelings. So, for example, somebody might cut themselves or hit their heads on walls, or other extreme self-harm processes, so they don't have to feel the feelings of, say, loneliness, neglect, humiliation, and shame, which actually could be there underneath the surface. Also, people self-harm to actually know at some levels that they're actually living. So from somebody who's depressed, for example, will often cut themselves or hurt themselves to actually feel their life spirit, if you like, because they've deadened themselves so much, they've closed their heart. So actually by feeling pain, they know they're alive and who they are. So there's some of the reasons why people self-harm. Let's look at some of the presenting issues. Cutting obviously is a common self-harm procedure. Many people do that as a way, like I've said in the last slide, to be heard, to deaden the soul, to not have to feel. Substance abuse is a very common way that people self-harm. Extreme alcohol, drugs, smoking, many of the addictive habits. Another way they actually people self-harm, which is a bit more insidious, is the negative self-talk that we often give ourselves, where we're very hard on ourselves, very persecutory, telling ourselves off, minute by minute, day by day. Just a continually dialogue of being harsh on ourselves and the child within ourselves. I put eating disorders at the bottom because that is a very common way that people actually self-harm. Anorexia, bulimia, many different ways of looking at this, from being obese to far too thin. So we see the presenting issues of self-harm in many different ways. If we look at the underlying causes, usually go back to some childhood trauma. People are reenacting the past in the present. People can cut and they can self-harm because they're in the middle of a life crisis. So acute stress brings about this dysfunction. Acute loss or bereavements from the past and the present, and of course often a real sense of devaluing, low self-esteem, believing they're not worthwhile, believing they've got no place in this world, that people don't want them to be there. A tremendous low self-esteem and body image problems usually come with this. So what is the treatment for somebody who's continually self-harming in this way? Well, counselling is obviously one way, psychotherapy is another way, and of course medication, that's drugs. So let's look at the first two. Counselling and psychotherapy, very important. Where somebody who feels so low that they have to harm themselves can talk to somebody in a confidential setting to get some relief, to be able to talk about their inner demons, to have a container, a place where they actually are being heard, perhaps for the first time for a long time. Very important. When we're talking about counselling and psychotherapy, we need to talk about safe harm. What is safe harm? Well, part of counselling and psychotherapy processes but also about teaching people to, if they are going to harm themselves, to do it safely, to be able to tell them the processes around unsafe practices, whilst they're looking at the feelings underneath. Okay, counseling and psychotherapy may take quite some time, but at least it's far better than living in this world of self-harm, or I think drugs as well. So first step is to reach out and to find a counsellor or a psychotherapist of your choice. Okay, thanks for listening. Bye bye.